everyone. The lecture for the today's topic is regarding radial knob. We will see the root value, formation, course, branches and clinical aspect of the radial knob. Radial knob, it is the largest knob of brachial plexus which is having root value C5, C6, C7, C8 and T1 of brachial plexus. We can say the formation or the origin of the radial knob is from the posterior cord of the brachial plexus. Let's know how to draw the radial knob. So we have to know the course also. So can you see here in the diagram, it is formed by C5, C6, C7, C8 and T1. Then the knob which is formed here, it is known as the radial knob. So the radial knob will pass through the axilla. In the axilla, it gives a cutaneous branch that is known as posterior cutaneous knob of arm. It also gives the muscular branch that is for the long head of triceps, medial head of the triceps. Then this knob will pass from the lower triangular space along with the profunda brachii artery. It means it will reach to the posterior compartment of the arm, and from the spiral groove it gives a branch to the lateral head of triceps, to the lower lateral cutaneous knob of the arm, and it also gives a branch to the anconeus, as well as it gives a branch that is known as posterior cutaneous knob of the forearm. Now from the posterior compartment of the arm, this knob will pierce the lateral intermuscular septum and comes towards the anterior compartment of the arm. In the anterior compartment of the arm, it gives a branch to the brachialis muscles, that is the small lateral part. It also gives branch to the brachioradialis. It also supplies to the elbow joint, as well as it supplies to the extensor carpi radialis longus muscles also. Near the lateral epicondyle of the humerus, the radial knob is divided into superficial part as well as the deep part, or we can say superficial branch and the deep branch. This superficial branch will pass deep to the tendons of brachioradialis and above the deep extensor muscles of the forearm, and supplies the skin of lateral side of dorsum of the hand and the lateral 3.5 digits except the nail buds. Deep branch will pierce the supinator muscles, as well as it will supply to the supinator muscles also. Then it will supply all the extensor muscles of the forearm, that is extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis. It will also supply to the inferior radio-ulnar joint, wrist joint also, and finally it forms a ganglion that is known as pseudoganglion. So let's see these branches again. So branches in the axilla, that is posterior cutaneous knob of the arm, which supply the sensory innervation of the skin on the back of the arm up to the elbow joint, knob to the long head of triceps, knob to the medial head of the triceps. Then this knob, that is radial knob, will pass through the spiral groove, which supplies to the lower lateral cutaneous knob of the arm. It also gives the cutaneous branch that is known as posterior cutaneous knob of forearm, knob to the lateral head of triceps, knob to medial head of triceps, and knob to anconeus also. Now there are three branches is given by radial knob near the lateral epicondyle, that is knob to brachialis, knob to brachioradialis, and knob to extensor carpi radialis longus. Then it divides into superficial branch and the deep branch. This superficial branch supplies to the lateral part of the dorsum of the hand, excluding the nail beds, and deep branch will supply all the extensor compartment muscles of the forearm, which is mentioned here, that is supinator, the extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, again extensor pollicis longus, extensor indicis, and it also forms a ganglion that is known as pseudoganglion. Let's know some of the clinical aspect related with the radial knob. So injuries of the radial knobs takes place in the axilla, in the spiral groove, and at the elbow joint also. So injuries of the radial knob in the axilla, In the axilla, the radial nerve may be injured by pressure on the upper end of the crotch, that is known as the crotch palsy. So features in such cases, there can be motor loss as well as the sensory loss. So motor loss, in the motor loss we can see the loss of extension of the elbow because the paralysis of triceps muscles takes place and which is supplied by the radial nerve. Loss of extension of the wrist due to paralysis of all the wrist extensor. This causes wrist drop due to unopposed action of flexor muscles of the forearm, and loss of extension of the digits also due to paralysis of extensor digitorum, extensor indicis, extensor digiti minimi and extensor pollicis longus. Loss of supination in the extended elbow because supinator as well as the brachioradialis are paralyzed, but supination becomes possible in flexed elbow because the biceps brachii is working and the function of the biceps brachii is also supination. There is sensory loss also. It means sensory loss on a small area of skin over the posterior surface of the lower part of the arm. Sensory loss along the narrow strip of back of the forearm also, as well as sensory loss on the lateral part of dorsum of the hand at the base of the thumb and the dorsal surface of lateral 3.5 digits excluding nail beds. You can see here this is known as the crotch palsy and this is known as the sacittinite palsy, while you can see here in the diagram that is known as wrist drop due to injury of the radial nerve. So we will see that the injury of radial nerve in the radial or spiral groove. In the radial groove, the radial nerve may be injured due to mid-shaft fracture of the humerus, and there can be a wrong placed intramuscular injection also. Direct pressure on the radial nerve by a drunken falling asleep with one arm over the back of the chair, that is known as Saturday night palsy, or we can say honeymoon night palsy. There can be motor loss as well as the sensory loss. So loss of the extension of the wrist as well as the finger takes place, that is known as the wrist drop, as well as loss of supination when the arm is extended. There is sensory loss also here, and sensory loss is restricted only to the very small area that is over the dorsum of the hand between the first and second metacarpals. Let's see the injuries at the elbow. But note that extension of the elbow is possible but may be little weak because the nerve to the long as well as the lateral head of triceps arise in the axilla, that is before the site of the lesion. Then injury of the radial nerve at the elbow means radial tunnel syndrome will be there, that is an entrapment neuropathy of deep branch of radial nerve near the elbow joint. Here the compression of the radial nerve at elbow may be caused due to following structures, that is by the fibrous band which can damage the radial nerve to the radiohumeral joint. Then we have the sharp tendinous margin of extensor carpi radialis brevis also, that can also compress the radial nerve. Then we have the vessels for the radial recurrent artery that also can compress the radial nerve. Then we have the arcade also, that is a fibroaponeurotic proximal edge of superficial part of supinator muscles. The features related with the injury of radial nerve at the elbow joint here, that is loss of extension of the wrist and finger but no wrist drop, pain over the extensor part of the forearm. You can see here this is known as the wrist drop, as well as this is known as the cutaneous nerve supply of the radial nerve. Thank you.